All right, welcome everybody. We are doing our very first virtual Food for Thought luncheon. And so we wanted to have a very special guest speaker. And we do have one here today here in our office. This is Courtney Smith. She is the Director of Hospital-Based Operations for ProCare. So thanks for joining us today.
Of course, I'm so glad to be here.
Well, one of the big things people are talking about even before COVID started, but even more so now that COVID is here, is telemedicine and telehealth. And I know ProCare is on the forefront of that, and we've really seen that grow and expand. Just first of all, tell us a little bit about what is telemedicine.
So telemedicine is basically a broad, overarching topic. Essentially what it is a provider and patient relationship via some sort of telecommunication device, whether that be like a Skype phone call or FaceTime or even just a plain telephone phone call is really kind of what the premise is. It's available so you can provide long distance care for patients without them actually being in your office. So,
is this something new that we're seeing here at ProCare? I know this has been in the works for a long time,
right.
But this is relatively new.
For ProCare and for the MCHS system, absolutely, it is a newer platform. In all honesty, telehealth has been around since the 1950s. They've done it a lot. They've done it a lot in rural area access hospitals. They've done it. Psych was kind of the big main push that they really started with way back when. So it's not necessarily a new technology, but it's new to us down here. It's really taken a broad step. So.
And I know a lot of work has gone into it, and especially with people, maybe some not wanting to get out there during COVID-19.
Yes.
This is a safer, more comfortable alternative for them.
It is. It just provides everyone with a heightened level of care. They're able to stay home, they're able to stay well, they're able to stay safer than they are having to be out in the general population with, just the unknowns that are going on, especially for our elderly population. It's really been a big hit for them.
Now, this is popular, as you mentioned. Do we think, maybe not now, but in the near future, that these telemedicine visits are going to replace in-person visits permanently?
I don't think they'll ever replace that inpatient visit, that in-clinic visit permanently. I think that you'll see a mix, most definitely. You'll see a mix of inpatient and those virtual visits. But really, even for our new patients now, they need those hard tones. They need to see those patients. And then we can do follow-up visits through telehealth. It's kind of like your OB patients. Like you need them in the office a couple of times, and then we can kind of continue on that path. But I think it'll be a mix.
And I think it'll be a perfect balance to what each person needs. Now, you mentioned some of the benefits of being able to follow-up visit or to stay more comfortable at home if you don't want to get out there. What are some of the other benefits we're seeing through these telemedicine visits?
Mental health, you've seen quite a few, not necessarily in our system, but mental health has been a big one that's really been like popping up on the telehealth side. Sick visits for kids, especially with your pediatric patients, your fevers, your broad spectrum, things like that. Medication refills has been a big one. Not necessarily surgical follow-ups, but your broad spectrum, that kind of like your routine clinic kind of visits.
And I can speak as a parent to two children, and we've used the telehealth. It's comforting to know you don't have to go wait in a line at the doctor's office with other sick children. You can call and get that diagnosis and get them treated accordingly over the phone. I think that's a big thing for parents.
It is. I think it is a huge thing for parents. The other thing that we've seen is you don't have to be in Odessa to have that visit. So you can be somewhere else. You could be traveling with your kids. You could be, in Dallas for some reason. You'd much rather have a virtual visit with your own provider in your home base instead of having to go see someone else outside of that. So that's been another big ticket hit with it.
That's very comforting to know, especially for families with kids. When would you recommend a patient go for a virtual visit? Is it a case-by-case basis, what you're more comfortable with?
It is. It's going to be more of a case-by-case basis and a provider-by-provider basis. So really it's that provider's level of comfort with that patient and that patient population and type, and then kind of what the patient wants as well. But really I would encourage everyone, you're going to have to call your PCP, call the clinic that you would like a telehealth appointment with, see if it's offered, and see if it fits for what your visit time needs to be.
So this essentially allows patients more of a personalized plan of what they feel more comfortable with and how they get treated.
Yes.
And that's always a good thing.
Of course, always.
Now, what health conditions or ailments would you say are typically ideal for a virtual? Like if I was sick with something, what do you typically see, I guess, on telehealth visits?
You'll typically see a lot of your basic, like your colds, your maybe flus, allergies, respiratory, those when it kind of comes to your sick visit type things. I know rashes has been a big one that they've really pushed for lately too. So kind of your broad spectrum stuff.
And when should, I guess on the other end, a person schedule an in-person visit if it's maybe a little bit more serious than you think you would think come into the office?
Yeah, I would think so too. I mean, it's gonna, like I said, it's gonna really go back to your provider, who you're seeing, and kind of what they recommend for your diagnosis that day.
Now, there's a lot of different telemedicine, telehealth out there. ProCare has their own very specialized telehealth
Yes.
program. Tell us a little bit about that and maybe what makes it a little more different than other programs.
So when we built our telehealth platform, of course, it was really spun on the COVID-19 era. But what it is it is a direct to consumer. It is HIPAA compliant. It's everything that you would need to be compliant with medical records. What we do is we send you, the patient, an email about your visit. You get all your new patient paperwork, your existing patient paperwork. We collect your insurance, we collect your copay. We do all of that stuff on the front end. You log into an app at the time of your appointment, and then the patient is waiting for the physician to come in and see them. So it's as easy as that.
It's just like an in-person visit, but everything's taken care of virtually and over the phone.
is.
And as you mentioned, HIPAA compliant, extremely safe.
Yes.
That's what people worry about when they do things online. Is
Yes.
they want to know they're safe and their information is
Right.
safe.
Right. Everything's done either via phone call with our front desk, or it's done through that compliant platform. So we won't, we don't anticipate any sort of security issues for any reason. So.
Any other things about the ProCare telehealth program you'd like to discuss today? I know it's really taken off, especially during COVID,
It
and it
has.
allows people to feel more safe in their own setting.
It has. I think it's something that will be here to stay. I don't know exactly kind of what it looks like in the future, but I don't think it's going away anytime soon.
Well, Courtney, we really appreciate you taking the time to be with us here today and explain a little bit more about telemedicine. I know it's new to a lot of people, but it's something, as you mentioned, it's going to be around for a very, very long time now, especially in light of COVID. So that was Courtney Smith, the Director of Hospital-Based Operations for ProCare. We thank you for joining us, and we thank you guys for joining us for our very first virtual Food for Thought Luncheon, and we will see you guys back here next month.